Hello and welcome. You're watching Hindustan Times. I'm Abhishek Singh. The World Health Organization recently announced an alarm over the increased spread of Omicron's new variant XBB1.5. To talk more about the situation, we're joined by Dr. Brian Wahl. Brian Wahl is an epidemiologist with Johns Hopkins Bloomberg School of Public Health, Department of International Health, and he's been based in Delhi for the last 10 years. He's been working with JHI India. And thank you for talking to us, Dr. Wahl. Thank you for taking out the time.
Thank you, Abhishek.
First things first, let me just first ask you about the situation at this point in time, because in India, over 200 cases have been identified of the new variant in the last 24 hours. So globally, what is the situation like?
So, as you mentioned at the top, Abhishek, the new Omicron variant is raising concerns about increased cases. The new Omicron variant has the ability to evade the immune system more than previous Omicron subvariants, and also it seems to be slightly more transmissible as well. And so this has raised concerns that it could lead to an increase in cases in many parts of the world. What we're seeing in the US, for example, is that this new subvariant of Omicron is accounting for more than 70% of cases, with some parts of the country, in the Northeast in particular, spikes in cases. I do want to mention, though, that there is no indication currently that this Omicron subvariant is causing any more severe disease relative to previous Omicron variants. In the case of India, where we have high levels of hybrid immunity due both to previous infections, including from a previous Omicron surge, as well as from vaccination, I'm not terribly concerned that the new Omicron subvariant will lead to a worrying spike in cases in India, especially severe cases. We're not seeing that in other places, with the exception perhaps of China, where immunity is much less compared to the rest of the world. But for now, I don't think it's too much of a concern for India in particular.
Right. So I want to go over things specifically, one after another. So if you look at the
Sure.
US in December, the rate of positivity in terms of the new cases which were coming up, the number was at 2%. It jumped to, in a matter of few weeks, 27%. And if you talk about India at this point in time, the positivity rate is 0.01%. So if US is an example in this sense, then what kind of problems are we looking at? I am talking, of course, about India in this case.
Absolutely. So test positivity at the very beginning of the pandemic was a really good indication of what an outbreak or what an epidemic of COVID looked like in any particular setting. This is when, at a time when diagnostics were largely being reported, and we were able to get a good sense of what the overall denominator was for cases that were being tested. Overall denominator in the sense that how many tests were being administered at any given time. This has changed, as we all know, during the pandemic, with a lot of home testing and a lot of testing not being necessarily centrally reported. So to compare test positivity over time is a little bit challenging. However, it still gives us some indication of what an outbreak is looking like. And so the very low test positivity that you've indicated in India, I think does not necessarily raise concerns. However, I do think that we do need to be vigilant, and in the US, in India, and in other places, I think genomic sequencing, in order to identify if new subvariants of Omicron are arising, which could potentially be of more concern, is critically important. We're not getting such data from China, and I think that is been a challenge for epidemiologists around the world. But other settings, other countries are reporting more genomic surveillance data, which is incredibly helpful at the moment for understanding how this subvariant and how other subvariants are evolving. But in terms of the test positivity in India, it doesn't seem to be much of a concern as far as I think most epidemiologists would chime in.
Well, that's good news. But talking about China, since you mentioned what's happening in China, and of course, the data is perhaps not as readily available as it might be in the case of United States of America or India. But so far as an expert, what is your assessment of the situation? How bad are things in China? China, of course, has recently uplifted the ban after massive protests across the country. But what is the situation really like? Do we have anything which we can sort of which can be substantiated and which can be sort of spoken about with some certainty?
So it's incredibly difficult to tell, as you were mentioning. I think what we do know is that China followed a zero COVID policy for many years now, leaving a population that was essentially immunologically naive to COVID. The vaccines, more than 90% of China, the Chinese population, has received at least one dose of one of the two vaccines that are being primarily used in the country. However, one dose from the studies that have been published from a number of settings around the world indicate that effectiveness against severe disease is lower, and that is against the ancestral strains of COVID. And so what we don't know is we don't know what one dose of these two vaccines does for Omicron. Presumably it would be much less. So there's a large immunologically naive population in China that's more vulnerable to Omicron and this subvariant of Omicron than in many other settings, which is very worrying. China going into the Lunar New Year, which is a time of celebration for China, where people travel back to their homes, largely in rural areas where there are not a lot of hospital capacity to deal with an increased surge in cases, also raises many concerns. And so the outlook, the prognosis for what an Omicron outbreak of this magnitude in China might mean is very worrying. I think it's something that's very unique to the epidemiologic situation in China. But one of the most worrying things is the potential for new subvariants to potentially arise when you have an unmitigated epidemic. Of course, that's when we could potentially see new subvariants emerging. And so that's why genomic surveillance, particularly from settings like China, is critically important.
Right. And talking about China, another thing, and this is more a case of a flipped coin, travelers from China, there is RT-PCR tests which are being done in certain countries. India is, of course, one of those countries which are doing RT-PCR tests on Chinese travelers. Morocco, in fact, has even banned Chinese flights. So far as travel bans are concerned, do you think they are proving to be as effective as perhaps they did in the early days? I'm talking, of course, about 2019.
So what we've seen of travel bans from the early stages of the pandemic is that at most you can expect a travel ban to delay the arrival of a new variant or the virus itself. And so why would you want to delay the arrival? Well, largely to protect your population by either providing building health system capacity, so ensuring that hospitals are well equipped, diagnostic capacity is up to par to deal with a potential surge in cases. Many countries around the world already have those systems in place. And so a travel ban is not going to keep this subvariant or likely any subvariant outside of their borders, and so I don't see a lot of utility in travel bans at this point in the pandemic, where systems are already well strengthened to deal with the surge in cases. However,
but would you say it makes sense for countries which probably don't have infrastructure in place still?
So potentially, but I think there are very few places around the world where there's not a lot of infrastructure to deal with COVID. Maybe in some parts of in some low and middle income countries, there may be less capacity to deal with a surge in cases. But the question would then be, if you were to put into place a travel ban, is that allowing you time to build capacity, and would that time be utilized to build capacity? And so that's a question for other settings to grapple with. Luckily, in India, we don't have that issue, and so I don't think it's something that needs to be strongly considered here. Now, on the other hand, given the low the lack of reliable data coming from China in terms of its genomic surveillance, I do think that there is value not to keep the virus out, but to understand what variants or what subvariants might be continuing to circulate, to do some sort of screening at the border, because that's going to be our best indication of what is maybe happening within the country if we're not getting reliable data from China. I don't think it's an effective tool for keeping the virus out, but it could be a useful tool for surveillance purposes.
All right, so travel ban, no more an effective way to rule the virus out. But that said, WHO recently, of course, said, as I also mentioned earlier during the interview, that this virus is perhaps one of the most, compared with other variants, more transmissible. So we know about the transmissibility of the virus. What about the severity?
We've seen no indication that this is any more severe than previous subvariants, especially of Omicron. In a setting with high levels of hybrid immunity, so both due to vaccination as well as prior exposure to both the Omicron variant and other variants as well, there's very little indication that any additional risk of severe disease would be associated with this subvariant.
Well, I think that's great news too. So my last question, it has two parts. So what's the way forward for countries, and what's the way forward for individuals? As individuals, what should they be doing? Should we go back to the kind of precautions that we were taking back in 2019, 2020, 2021? Masks, social distancing, washing our hands, things like that for individuals, or anything else apart from that?
So for countries, I think the most critical thing is to keep an eye on hospitalizations. In public health, we call that a lagging indicator, because it's only when it's gotten to a certain level of severity that we understand what's happening, if we're only tracking hospitalizations. But that's really the best, I think, indicator we have at the moment about whether or not we should be raising alarm bells. We haven't seen that here, haven't seen it in other settings as well. And so continuing to keep an eye on hospitalizations and severity associated with new subvariants, I think is critically important. The other thing that we need to be doing at a population level is, as I mentioned earlier, genomic surveillance. We need to know if new subvariants are emerging. They will emerge. It's important to know when and where they do emerge, so that we can keep an eye on them and have a good understanding of whether they're causing spikes in disease that should be worrying. At the individual level, I think it's now to a point where individual risk assessments need to be made. And so, with interventions like wearing masks and social distancing, these are, I think, wearing masks in particular, low burden, low cost interventions. And so if you, as an individual, feel that you or someone within your close network, within your close social network is at higher risk, maybe they haven't received the vaccine, maybe they've never become ill with COVID, and they're otherwise of a vulnerable demographic, then yes, maybe at this point it would make sense to wear masks, especially while indoors and in crowded areas. Avoid places without good ventilation, so on and so forth. I don't think that those are necessarily high burden interventions. And so I would say at an individual level, taking those risks assessments is important. But at a national level, at a policy level, I think where we currently stand, unless the situation changes dramatically, where we currently stand, I think we're looking good and would continue forward.
You're looking good. So that's good news. Dr. Wahl, thank you so much. Thank you for talking to us. Thank you.
Thank you, Abhishek. Take care.